COVID-19 is seeing a summer surge around the world. The World Health Organization says wastewater testing detected new waves of the infection in the U.S., Europe, and in the Western Pacific. We're bringing back Mercy Health Chief Clinical Officer Dr. James Kravic to explain what we need to know, especially as we head into the fall months. Thank you so much for coming back.
Thank you for having me.
Yes, we're seeing a summer wave. Wondering what makes this spike a little different than the last couple of summers that we've had.
You know, we are seeing more patients both on the inpatient side and the outpatient side with COVID-19 now. Now we're in August. We're seeing more patients in August than we did in June and July. The good news is it's not overwhelming at all. The symptoms are mild for the most part. I think this is just a normal uptick that we're going to see every season or every year or so. I think it's probably just a normal course of events. So the good news is the severity is mild and the numbers are not overwhelming.
And the Mahoning County Public Health, they reported on their dashboard, which we have for people to see, only 113 COVID cases last week. Many who test positive also go unreported. So maybe these numbers aren't accurate, but wondering which age group this is primarily affecting right now. Who needs to be on alert and maybe make sure they're aware before they go out and do different things throughout the community?
You know, looking at the data is really hard because the vast majority of people that test positive for COVID don't report it. They're usually self-tests. And so it's hard to know specifically which age group is contracting COVID more. However, I think the message is those that are more immunocompromised or those that have other medical problems, those that are around those that are medically compromised, those are the ones that I worry about most. And so that's probably the take-home message is it's really individualized. It's either if you are sick yourself or at high risk for being sick, or you're around people that are at high risk for being sick. Those are the ones that I worry about the most.
What are some of the most common symptoms from the latest strains?
You know, it's pretty much the same now as we've seen in the past. You know, with the upper respiratory infection, the cough, the sore throat, feeling fatigued, that really hasn't changed. You know, in the beginning when the strains changed, we would see different symptoms, but that's kind of calmed down, and that's a good thing.
What are you recommending when it comes to vaccines or boosters, and are those even available?
You know, there hasn't been a new strain of vaccine since last fall, the fall of 2023. We're expecting one in the fall of 2024 for the 24 to 25 season. So we don't know. Right now, if you haven't received the booster, you should. If you haven't received your first dose, you should. But if you're up to date and you've received your booster, we're really in a wait and see approach right now. Meaning, if you've had that, a new one's going to come out, and they may or may not recommend another booster. So we won't know what the CDC recommends at this point. So it'll probably be a few weeks or a month or so.
Okay, we'll be watching for that update then. Thank you for putting that on our radar. As we get closer to the back to school season and the fall indoor winter months, how important might it be for those at-risk groups to also get the flu shot? Do you think that they should get them at the same time if they get a COVID? What are your recommendations when it comes to the flu?
You know, it is permissible to have COVID and flu vaccines at the same time. In the beginning, we weren't sure of that, but you can receive them both. You know, flu vaccines come out usually in the pharmacies first, in the public health departments second, usually in the hospitals second. And they come out in September, then later in the public health departments in later September or so. But that's the right time. End of September, early October is the prime time to receive your vaccine. And we do recommend that yearly. So again, separate from COVID, where we have a new strain, a new vaccine coming out, and we're not sure of the recommendations, the flu vaccine has 3 strains. One of them is new this year, and that was changed based on the virus that changed over time. So one flu A is different, the others are the same. And we do recommend the booster, or I should say the annual flu vaccine for all of those, people at risk, and which is pretty much everybody. Obviously see your doctor, make sure you're in the right category, but that's something that hasn't changed. Before COVID, after COVID, that hasn't changed.
All right, definitely some big questions people have, especially, like I said, as we get sadly to the end of our summer. Thank you so much for joining us, Dr. Kravic.
Thanks so much for having me.